What percentage of mold is inhaled versus eaten versus through our skin?
Well, I don't think anyone knows the answer to that question, but I'll give you my clinical impression and those of my colleagues, which is I think that the vast majority of mold comes in inhaled. We get it from mold-damaged buildings. We inhale the spores, fragments of spores. We take the mycotoxins in that way. And most people would agree that that's the biggest way we get it. Is there some mold in food? Yeah. There are reports of epidemics of mold toxicity that occur when a silo of grain gets moldy or peanuts get a huge batch of peanuts that are being made into various products. So that's well known. But there is governmental oversight on mold to the extent that my opinion is that most of the mold toxin we get does not come from the food that we eat. It primarily comes from what we're exposed to. Can get it through skin. Mold toxin can be absorbed directly through skin, but I don't think most people come in contact with that. I have had a few patients who mistakenly, without wearing gloves, tried to clean up the mold that they found in their home, and it made them really, really sick. So can that happen? Yes. To my knowledge, this has not really been studied, but I did a small study with Great Plains Lab when they were called that, in which we took 8 patients who had had mold toxicity. We had them not eat all of the foods that are known to be potentially moldy for 10 days. And then we did their urine mycotoxin test. Then we had them pig out on all of those foods for 10 days. And we repeated the urine mycotoxin test. To our surprise, 7 of the 8 patients' mycotoxin levels went down, eating supposedly moldy food, and 1 patient had a slight increase in ochratoxin. And so we need to do a much larger study than that. That's not enough to really write home about.